Hello and welcome to this part of your dermaplanning and facial therapy course. In this part, we're going to be looking at the types of acnes that the client might have and how to look out for those so you could treat them the best way possible. So what type of acne do I have? Acne can form several types of skin blemish, each with a distinct appearance and symptoms. Most minor acne blemishes respond to at-home care and over-the-counter medications. However, people with severe or long-term acne should speak with a doctor or dermatologist. Acne affects around 80% of adolescents and young adults. About 40 to 50 million Americans have acne at any given time. The following are common types of blemish associated with acne. So you can get whiteheads, blackheads, pustules, which are commonly called pimples. You can get papules, cysts, nodules. So if you're not familiar with these terminologies, do look it up. And the more research you look into each of these types of acnes and skin issues, then the more you're going to gain knowledge. Each type of acne lesion requires a different treatment. Receiving prompt, correct treatment can reduce the risk of long-term skin complications such as dark spots and scarring. Acne blemishes fall into two categories depending on whether or not they cause inflammation of the surrounding skin. So you've got non-inflammatory acnes types, which is whiteheads and blackheads, are types of non-inflammatory acne lesions. They are the least severe forms of acne. Non-inflammatory blemishes usually do not cause swelling and are not very painful. Then you have whiteheads. The medical term for whitehead is closed comedones. These are small whitish or flesh-colored spots or bumps. They usually have a white circular center surrounding by a red halo. Hair will sometimes emerge from the center of a whitehead, or it may appear to be trapped within the blemish. The skin around a whitehead may appear to be tight or wrinkled, especially when the whitehead is large or especially raised. Whiteheads typically do not cause scarring. So looking at blackheads now. So blackheads are also called open comedones. They are small black or dark colored spots and they may appear as slightly raised bumps. The skin around a blackhead usually appears normal while the center of the blackhead is darker than the surrounding area. The coloration is not as a result of trapped dirt. Blackheads are simply whiteheads that have opened and widened. When the contents of a whitehead are exposed to air, they darken. Treatment options. Many over-the-counter rinses, moisturizers, gels, toners, and creams can treat non-inflammatory acne blemishes. So please do check with your local clinic or go to your GP. They often contain a mixture of active ingredients. So the following ingredients in over-the-counter treatments can help to break down whiteheads and blackheads. So you've got benzoyl peroxide, salicylic acid, sulfur. You have resorcinol. So these are different kind of ingredients that is being used. I'm not sure if my pronunciation is correct, but you get the gesture of it. So obviously we're going to provide you with the manual, so please do have a look into that. Also, several home remedies and lifestyle changes can help to reduce most minor to mild forms of non-inflammatory acne. It may help to try washing the face with lukewarm water, okay, and soap twice daily. Washing the whole body every 2 days, reducing stress, eating a healthful, balanced diet, staying hydrated, avoiding overwashing or irritating the skin, limiting exposure to the sun, always wearing a sunscreen when outdoors. People should never pop acne blemishes, okay? Doing so can lead to complications such as nodules, cysts, scarring, dark spots, pitting, okay? So inflammatory acne types. These are inflammatory. So inflammatory acne blemishes include papules, pustules, nodules, and cysts. So you can find this on page 31. Inflammatory acne is more severe than non-inflammatory acne, and this type is more likely to cause complications such as scarring or pitting. Blemishes or lesions that are inflamed or red, swollen, and warm to the touch can result from inflammatory acne. Minor to mild forms. So you get papules. Papules are bumps under the skin's surface. They are solid, tender, pink, and raised, and the skin around a papule is usually slightly swollen and red. Unlike whiteheads, papules have no visible center. Unlike blackheads, the pores of a papule do not appear to be widened. Papules developed when whiteheads or blackheads cause so much irritation that they may damage some of the surrounding skin. The damage leads to inflammation. So pustules, pimples. Pustules are larger tender bumps with a defined circular center. The center is filled with whitish or yellowish pus, and the bump has a pink or red base. Immune cells and bacterial cells collect to form this pus. Pustules typically look like much larger than and more inflamed whiteheads. Treatment options. Several home remedies and over-the-counter medication can treat minor to mild papules and pustules. The following tips can help. Washing the affected area with cool water and soap using clean hands or a clean, gentle face cloth twice a day. Applying a warm compress or cloth available to buy in pharmacies and online. To be affected area for the so you can basically apply a warm compressor cloth available to buy in pharmacies online to the affected area for 10 to 15 minutes, okay, to encourage trapped debris to rise to the surface. So using products with benzoyl peroxide to combat bacteria, using products with salicylic acid to remove dead skin cells and other debris. Now, these products you have to check with your GP and also then go to your chemist, or if your GP refers, general practitioner refers you, then that's even better. So please do get medical advice before you go and buy these products, so you can make sure that your skin problem matches with the needs that will be provided by those medication. So moderate to severe forms. Nodules. Nodules are hard, painful, inflamed lumps located deep within the skin. They look like larger, deep papules and have no visible center or head. This type of acne lesion develops when clogged pores damage tissues and cells deep beneath the skin surface. Nodules are a severe form of acne blemish, and they can cause skin complications such as dark spots or scarring. Cysts are very large, soft, painful red or white lumps situated deep in the skin. They are filled with pus. Cysts form deeper within the skin than nodules, and they are the most severe type of acne blemish. Cysts can also cause skin complications such as scarring. So these are some of those skin issues that we have identified. Now we're going to be looking at treatment options. So people cannot treat moderate to severe inflammatory blemishes at home. These lesions require care from a doctor or dermatologist. The doctor can use many products and procedures to treat nodules and cysts. These include antibiotics such as tetracycline, doxycycline, and amoxicillin, topical corticosteroids, oral contraceptive for hormonal related acne. Then you have systematic retinoids such as isotretinoin. Then you got steroid injections, chemical pills that are available in pharmacies or online. You can get photodynamic therapy to combat bacteria, drainage and extraction to remove large cysts. So what causes acne? So normally dead cells collect in the skin's pores and slowly rise to the surface of the opening and eventually fall away from the skin. A natural body oil called sebum helps to prevent skin cells from drying out. The glands that produce this oil are attached to the pores. When excess sebum builds up, it can cause dead cells to stick together, forming a mixture that becomes trapped in the pores. Acne occurs when a pore becomes clogged with dead skin cells, natural body oils, and a type of bacteria. So these bacteria live on the skin and are called Propionibacterium acnes. So that's the scientific terminology. If they enter and infect clogged pores, This causes acne blemishes to form. So when to see a doctor? Okay, so in cases of minor to moderate acne, a person will generally have to use home and over-the-counter remedies consistently for 4 to 8 weeks before they see results. More severe inflammatory types of acne tend to take much larger to clear up. Speak to a doctor or dermatologist if whiteheads, blackheads, papules, or pustules um, are severe. Do not respond to over-the-counter medication, um, which can be very painful and very large, and it could bleed a lot as well. So release a lot of pus cover a significant portion of the face or body, cause emotional distress. So these are um, some of the things that that could cause someone. So it's best you get it checked by a specialist like your doctor, GP, general practitioner, and then take the advice and then go ahead with that. Because most of the time it can even cause a lot of sensitive issues, especially around the eyes and lips. So it's best to treat it with the highest level of professionalism that you could get from your healthcare provider. So most active ingredients and over-the-counter products available in prescription strength treatments. Okay, so dermatologists can also remove lesions that are very large or persistent. They can also remove those that do not respond to other forms of treatments. Always see a doctor or dermatologist about nodules and cysts, because these require medical care. Untreated nodules and cysts and those that have been picked or popped can cause scarring. So just to bear that in mind. Now we'll be looking into the pH balance of your skincare products and why it matters so much. Okay, so there are some Korean skincare products in this manual, but do check with your local stores and go to your local healthcare providers to find out which will be the best blend for yourself. But we advise going for organic products because it kind of like fits for all sort of skin types. So in high school chemistry class, okay, you most likely learned about pH, okay, and dipped little colors. So we dipped those colors just to find out the pH and stuff. Changing strips into liquid to see where they fell on a scale of 1 to 14. So in cases you need to refresher, anything below 7 is acidic. Above 7 is alkaline, and 7 is neutral, like water. Okay, explains cosmetic chemist Ginger King. Has a high school on the brink of failing chemistry. All of this has a lot more to do with beauty, particularly skincare, than I ever imagined. The pH of your favorite cleanser, toner, and moisturizer affects your skin, whether you realize it or not, and chances are it's not for the better. Because of this, Korean skincare products are often specially formulated so that doesn't happen. Lab researchers from the beloved K-beauty brand to tell Allure that they make it a mission to ensure as many of its products as possible have a low pH to effectively help its customers with their various skin concerns. In fact, several specifically request that low pH products, which led it to make signature low pH Good Morning Gel cleansers, although Course doesn't especially list the pH level of its products on their packaging. Many Korean beauty brands like Aqua and Papa Recipe do, so people can build a perfectly pH balanced skincare routine. So these products are based in Korea, but I would, if you are in UK or if you're in America or in any other parts of the world, look at your local healthcare providers and find out what kind of products that you could get that will have the right pH for you. What is a typical pH to skin? So no matter which expert you ask, they will tell you skin rings up at a solid 5.5 on the pH scale. So skin is an incredibly delicate organ, says New York City-based dermatologist Rachel Nazarian. Like every other organ in our body, skin performs its best within a narrow, ideal environment, especially when it comes to pH. When it deviates from that magic number, harmful bacteria could grow, triggering inflammation and skin conditions such as acne, eczema, and such other conditions. Okay, so 5.5 is a good pH balance to have. So do check that all your products are within that range, according to Rachel, um, who is the New York City based dermatologist. So, like coffee, your skin is on the acidic side. In fact, it's covered in what's called an acid mantle, which helps maintain your skin's pH, prevents infection, seal in moisture, and keeps skin firm. Acidic conditions maintain skin barrier functions and the body's ability to ward off infection. Joshua, the director of cosmetic and clinical research at Mount Sinai Hospital in New York City, has told Allure, and with age, the acid mantle diminishes and skin becomes less acidic, making it drier and more prone to fine lines and wrinkles. So, by reading all this, now we come to the conclusion that what's the typical pH of skincare products. So, as soon as you jump into the first step of your morning or nightly skincare routine, you can alter the natural pH of your skin and dismantle the acid mantle. Okay, so when that happens, the skin's ability to repel environmental things could be that could affect it. So this is something that the Austin, Texas-based dermatologist Ted Lane has mentioned. This would lead to increased water loss from the skin and causing dryness and scaling, as well as irritation, redness, and itching. So basically, your beloved skincare products could be working against you and could be the source of your skin problems. So when former cosmetic and biotechnology analyst Maria Vara Arredondo came to this very realization, she decided to start a skincare line that focuses on creating pH balanced cleansers, serums, and creams. For most of my teen years, as well into my 20s, I struggled with acne. I tried everything: benzoyl peroxide, scrubs, sulfur, antibiotics, Accutane, she tells Allure. Okay, after meeting with the heads of research and development of a pharmaceutical company, Arredondo discovered what she called the significance of pH balance, both in formulating products that work effectively on the skin and in maintaining healthy, radiant, youthful skin. She realized that much of the irritation and inflammation of the skin was due to using products that were damaging her skin's pH level. So now she formulates products she says are pH optimized. Other beauty brands use similar wording like pH balanced or balanced skin pH level. Nazarene says all means that they sit around the 5.5 mark. So 5.5 is the magical number here, guys. Make sure that all your products are within that range to be on the safe side. If they are higher or lower, then that's how they will be affect your skin. So just make sure that it is at around that range, but double check in case all of these experts are kind of like saying things without just to be on the safe side. But 5.5 is what's recommended by all the experts that we have just gone through, dermatologists and all the rest of it. So high pH 8 to 14. So if you have a high pH skincare products with a high pH level, also known as alkaline, pose the biggest threat to your skin's pH and acid mantle. So they'll make your skin feel smooth at first, but it will be disturbed and rough in the long run. King says that tight, squeaky, clean feeling you might experience after washing your face is the true sign of cleansers with the high pH and damaged skin barrier. They as well as other alkaline skincare products tend to strip away sebum and natural oils. As a result, undesirable effects such as redness, inflammation, scaling, and dryness can occur. Lane says your skin might even break out just because you cleanse with an alkaline face wash. To help reverse this, Nazarene advised repairing the damaged skin barriers with topical probiotics. Depending on your skin type, you're sure to find amazing options on our list of favorite skincare products infused with probiotics. So low pH 1 to 6. So if you have a low pH, because your products with a low pH are at a level closer to skin's natural pH, they will more effectively work with your skin and helps cell turnover gently. King says they're more likely to keep skin bright and smooth instead of flaky and angry. However, certain products can be too low of a pH for skin and irritate it. At home, peels and other acid spike products like tends to have a lower pH level, so making them great exfoliants, but just as stripping as products with a high pH. I recommend following exfoliating products with a moisturizer to help restore the acid mantle and protect their barrier function. Lane suggests corks, in particular, counteract the stripping nature of acids with the soothing ingredients that still maintain a low pH. As for its low pH cleansers, Course RX, so the word is COS RX Lab, researchers share that they use a milder form of surfactant derived from natural ingredients to cleanse through without irritating the skin. So like mentioned earlier, try to go for natural products or organic products that you would find. You can find a lot of these products on eBay, Amazon, and other places like that. But just double check, look at the reviews. If you stick to organic, guys, then there's nothing that could go wrong. Okay, so always go for organic products just to be on the safe side. Because otherwise, unless you know your products well, unless you know the line of products well, then you could go for products which kind of like doesn't have natural organic ingredients in it, but it will not harm your skin and it will be around the 5.5 mark. What's the ideal pH for skincare products? So as mentioned several times during this talk, skin products with a pH of 5.5. Anything they could be as low as 4.5 and high as 7. King says the general is slightly acidic is preferred for the best complexion. She adds, if you are unsure of what exactly the pH of your favorite skincare product is, you can check by literally pH testing them with litmus paper. Packs are available on Amazon. Okay, so just do check with them. Otherwise, just stick to organic products. So what are the best pH balanced skincare products? So if you don't have the time to pH test your products or read the fine print, then several alert editors slather or Aquell's offerings on a daily basis, including its liquorized pH balancing cleanser, cleansing toner, and new liquorized pH balancing essence mist. Both have huge 5.5 printed on them. So look at those products. Okay, so I'm going to give you, this is on page 36. Did you know that pH balancing skincare is key to healthy looking skin? So Mary Claire, okay, is supported by its audience. When you purchase through links on their site, for example, you may earn commission on some of the items you choose to buy. It's all about the balance. So perfect skin doesn't really exist. We all have our own issues, okay, that we are dealing with. Everything from bags under our eyes and adult acne to pigmentation issues. However, there is something that we can all do to ensure that our skin is looking and feeling better. Keep the skin's pH levels balanced with some pH balancing skincare. So what is pH? You would have learned about pH in chemistry. So I think we've been through this part. Why do you need to keep your skin's pH level balanced? So skin ideal pH is 5.5, okay, which is slightly acidic. When it's balanced on 5.5, the skin is working on its optimum level. Through this balance out work, it's best to use pH levels will suffer, resulting in sensitivity, wrinkles, okay, if it goes too high, inflammation or acne. So mega dermatologist Dr. Colbert of Colbert MD Products mentions here that pH is more than a marketing ploy. Okay, our body and skin requires a balance between alkaline and acidity for our skin acid mantle. Okay, the barrier that keeps moisture in and germs out, and toxins out. Anything over 7 is considered alkaline. Okay, skin that falls on this ends of the scale tends to be drier and more wrinkly, while skin that's not too acidic can appear red. Okay, so irritated and itchy. Slightly acidic around 5.5 is epidermal heaven. So 5.5, guys, just make sure your products are 5.5. So, how do you keep your skin's pH balanced? The easiest way to keep your skin's pH balanced is to use products that don't muck the pH around. Okay, here is our roundup of the best pH balancing products. So, micellar water. Okay, so you can get micellar water by Avene. You can get toners, cleansers, and toners. Obviously, you're going to get the manual, so do have a look into this. And then you have some United States products, toning products here: Drunk Elephant, Peaky Bar, Seabamed, Clear Face Care Gel, and so on. So these products are here. I'll send it to you guys. The manual will come with it. Furthermore, you also would need to look into other kind of things that would help with the pH balance, such as pH balance.